Here is the phantom, which represents the patient's back. On this simulator, the most cranial rib is rib 3, and the most caudad rib is rib 8. Depending on the specific objective, you can change the angulation of the patient's back and orient the patient from a sitting position to a lateral position. If you wanted to, you can even orient the patient to a prone position. In this prone position, you can move the patient to having their head either to the left or to the right side. You will use the tools in front of the simulator to assist you when performing the blocks. The first tool is the ultrasound. This is not a real ultrasound, but it is more so a mixed reality ultrasound. On the ultrasound, there is an orientation marker, and the computer screen represents the ultrasound screen. In order to facilitate movement with the ultrasound, you have to use baby powder. When you place the ultrasound on the simulator, you will see the ultrasound image pop up on the computer screen. Notice that the orientation marker is in the top left corner of the ultrasound image. The next tool is the block needle. This needle has depth marks and wings to hold. The next tool is the search needle. This needle is used for simulating numbing tissues and palpation. You can simulate injections with this needle as well by poking through the skin and injecting air. The next tool is the loss of resistance syringe. This syringe is attached to the block needle. You use this tool to advance and check for a loss of resistance. Lastly, you have your Sharpie marker, which is used to mark the simulator. There are two additional buttons that the simulator has. The first button is the hydrolocation button. When you need to hydrolocate, you can use your foot to press this button. When you are finished performing a block, you need to press the needle in place button so you can be scored. When you are finished with the procedure, you can use the alcohol provided to wipe your markings and begin your next block. If you start and drag your mouse to the right side of the screen and click on visualization mode, you can get the 3D picture of what is below the skin. The important tool to use that will allow you to change your point of view is this little camera tool. When you push on the button, you can move the camera in any way you want. When you are satisfied with your view, all you have to do is release the button. As you move the camera around the simulator, the point of view will change. You just have to be careful when changing your point of view because if you zoom in too close, you will have a distorted perspective. Just as an example of what we mean, if we inserted the needle in this view, it seems to be angulated medially. However, if we go to preset views on the right side of the screen, this will display our orthographic view. You can now see that the needle is actually relatively straight. More details on visualization features are shown in future videos.